Hi, my name is Dr. Alexa Parker, and today I'm going to be discussing our approach to really looking how we look at your health overall. Okay, one of the things I'd recommend that you do prior to watching this video is filling out the health questionnaire and the metabolic questionnaires that we had sent to you in a link. That'll really help you to see how we really look at the whole body. And our goal together is to really help you restore your life and not simply just give you a medication to help mask the symptoms. Many of you have already been to many different doctors prior to coming to see us. And their approach is, unfortunately, a lot of times, is to just give you a medication. And oftentimes we see that patients have been given medications for one symptom, but what happens is they get another symptom as a result of that first medication. So our goal is not to just continue to help you mask the symptoms, but actually correct the cause of the problem, okay? So some of you who are watching our video today actually suffer from a chronic condition. So you may suffer from a thyroid condition, a chronic fatigue condition, fibromyalgia, peripheral neuropathy. What I'd like to tell you about these conditions is that you're not just suffering from this condition, okay? What you're actually suffering from is something called a web of physiological dysfunction. And what that means is that your body as a whole is starting to break down. And how we actually need to approach it is to look at how your body is functioning together, not just the one area that's functioning improperly, but the whole system, okay? So in order to do that, what many of you are going to need to do is actually have a lifestyle change. And we're going to actually help you do that. So some of the things that we can look at today are the health questionnaire that you filled out. The health questionnaire that you're filling out has 1, 2s, and 3s that apply to your symptoms. Those actually apply to your brain, or how well your brain is functioning. So your brain actually has 5 lobes. One of the lobes is the frontal lobe. The frontal lobe helps control your ability to focus, your ability to plan, your judgment, your social skills. So in order to determine how that's functioning, we need to look at these questionnaires and see where your symptoms lie in that area. Many of you that have a chronic condition actually see symptoms in this area. You can't focus, you can't concentrate, you can't complete tasks, right? This means you're suffering from a brain-based problem. That's why we have to look at the brain in order to get you well. Another area of the brain, another lobe of the brain, is called the temporal lobe. That area controls your ability to remember things. Many of you may have symptoms such as not being able to find your car when you leave the mall, or having problems remembering names and faces. Those are all symptoms of a temporal lobe problem. How many of you had your doctors evaluate your temporal lobe? If you're suffering from a chronic condition, that's an area that we should really look at. Parietal lobe. How many of you sitting at home today are actually in pain as you watch this video? That means that you have improper functioning in the parietal lobe, abnormal sensation, feeling things that aren't there. Those are all symptoms of a parietal lobe issue. How many of you have had your doctors evaluate that area? Probably not, because they don't generally look at the whole picture, right? So what I'm here to tell you is that you probably have a brain-based problem. If you have a chronic condition, your brain is starting to malfunction. And those are some of the symptoms of that. We're going to be able to detect those by evaluating you. Also, if we look at some of these chronic conditions like we talked about, thyroid, chronic fatigue, fibromyalgia, chronic pain, what you actually have is a system that's starting to break down. Your body is supposed to function together in order to be healthy. So if we look at category 1 that you filled out on your metabolic questionnaire, that relates to your colon. If you're having problems with eliminating your bowels, if you're having too many bowel movements, if you're having bloating, constipation, that all relates to the colon. I'm sure many of you have not had a doctor look at that, but we have to. We have to get your whole body functioning at an optimal level in order to get you well. Stomach, that's category 2 and 3. The stomach is actually a barrier. It creates a barrier for you to ward against infections. The stomach has to function at an optimal level. Category 4, large intestines. That's where 90% of your nutrients are absorbed. 90%. If we don't fix that area, we're never going to get you well, okay? And I'm sure that many of you have been to doctors but have not even discussed your large intestines with you, even if you have a chronic condition. And we have to look at the whole body. Number 5, gallbladder. Many of you may have had your gallbladder removed. However, you still could have symptoms in that area. Problems digesting fatty foods, pain, a metallic taste in your mouth after you eat. Those are all signs and symptoms of a malfunctioning gallbladder. Blood sugar balance. Optimal range is 85 to 99. If you have low or high blood sugar, you are constantly stressing your brain. You're actually killing your brain. And one of the reasons why Alzheimer's is actually called blood sugar or diabetes of the brain is because of that. It actually destroys the way the brain works. So we absolutely have to look at this region of the body as well. Adrenal function. Category 8 and 9 are adrenals. If you're having difficulty sleeping, if you're having problems getting out of bed in the morning and you're craving sugar, those are all indications that your adrenal glands are malfunctioning. Your adrenal glands make a hormone called cortisol. Cortisol is our stress hormone. When we're under stress, our body produces cortisol so that we can escape that stressor. However, if our adrenals are malfunctioning, that cortisol level is going to be completely off, and it'll affect our sleep-wake cycle. It'll also affect our hormones epinephrine and norepinephrine. That can actually increase pain in our body when those levels are abnormal. Thyroid function. Your thyroid gland has receptors in every cell in your body. One of the reasons why people have fuzzy thinking, depression, cold hands and feet with thyroid problems is because of that reason. We have receptors in every cell of our body. So we have to look at the thyroid. Hormones. We also look at salivary levels of the hormones. So progesterone, estrogen, testosterone. We evaluate all of those areas. So again, in order to get your body healthy, we have to look at the whole system, not just the parts. So now my husband, Dr. John Parker, will be telling you about what tests that we do in order to get you better, and go over a little bit more about our approach.
Healthy, not to be part of the social norm. The other thing is when we run a thyroid panel, we run extra things like T3 reuptake, thyroid conversion, because T4 has to be converted to T3. We run panels to look at antibodies to see if you have actually an autoimmune condition. Most thyroid people are autoimmune, Hashimoto's thyroiditis. In Hashimoto's thyroiditis, there's a triad of things that are wrong with it. The first thing is with Hashimoto's, they have positive antibodies against an enzyme that makes their thyroid work. That means their immune system is attacking itself. The second thing that they have been shown to have is gluten sensitivity, and we run special tests for that. And the third thing that they tend to have is an autoimmunity against the parietal cells in their gut, and therefore they have pernicious anemia. So you can take all the thyroid replacement hormone in the world. It may make your number improve, but it's not making you feel any better. And a classic sign of a Hashimoto's patient that's just being dealt with the standard medical model, they keep changing your dosage. They keep raising it up until the ultimate goal is just to burn out your thyroid. But the thing is, it doesn't make you feel any better. So we run functional-based labs, complete metabolic panels. Another one we tend to run on people is an adrenal stress index. Your adrenals are a gland that sits on your kidneys, and they release cortisol in response to stresses. They also release hormones such as DHEA, which is the mother of all your sex hormones. They also stimulate the release in men and women to the pituitary gland of your sex hormones. So many people might be told that they have low testosterone and be given a replacement level of testosterone, let's say for a male, and the reality is you're not releasing any luteinizing hormone in the brain. In females, the same thing, especially if they're having a lot of adrenal stress, they're going to have major hormonal problems. And you can chase all the replacement hormone in the world. If you're not fixing the adrenals, it's going to be draining your hormones. Adrenal stress index is a saliva index taken 4 times throughout the day, and it looks at your rate and rhythm of the release of cortisol. Cortisol is released in a normal pattern as our alarm clock. It rises through the day and it declines in the afternoon and dips at night. Well, you can have really high levels of cortisol because you have physical stresses, chemical stresses, pain, inflammation. But the problem is your adrenals will eventually get fatigued, and in that process it affects sugar regulation levels. So the adrenals have a huge impact on your body. But in that process of getting really high before it gets fatigued, really high levels of cortisol are toxic to the brain, especially the temporal lobe and the hippocampus. It affects thinking. It affects our barrier system, like our gut barrier system. So it predisposes people to have leaky gut, which is one of the #1 precursors to having an autoimmune problem. The other thing is, when we look at the rhythm, you can have a shift in your circadian cycle in response to your cortisol rhythm. So if we see a shift in that rhythm, I know there's a person who doesn't sleep well at night. So even if they get 8, 9, 10 hours, they still are fatigued. Which I want to bring you back to how we supplement based on these kind of labs. I'm not an old school practitioner and just say, take this, this is good for your adrenals. Depending on your pattern is how we're going to supplement you for things. Your adrenals may need some support, but the brain function that tells the adrenals, the hippocampus, hypothalamus, pituitary adrenal pathway may need very specific nutritional supplementation. And then you may need specific supplementation to work on the neurologic shift for your circadian rhythm, your sleep-wake cycle. Another important test we do is genetic stool profiles. Those are DNA tests. Very, very advanced testing compared to a plain standard microscopic stool profile. We run this test and we look at people's gut systems, because people that have inflamed guts have problems with their immune system and have inflamed brains. It also drives autoimmunity. So when we do a DNA stool profile, we're looking for dysbiosis, meaning lack of good flora, of good microorganisms that protect your immune system, that are your immune system in your gut. The next thing we look at is opportunistic and pathogenic bacteria. You can definitely have a lot of infections in your gut that are hidden, and they're driving your immune system and affecting your absorption and causing you to have things like brain fog and fatigue. The last thing we look at well, 2 more things. We look at yeast overgrowth. Do you have a yeast burden? And do you also have a hidden parasite? Hidden parasites can be very difficult to find, and that's why I really like this test, because depending on what it is, we can really focus to kill, repair, and replenish your gut. Cyrex Lab is a specialized test that we use looking at different parts of the gut system and food sensitivities. But it's not like a 100-panel, what are you allergic to? Because if you have a problem in your gut system, a barrier system problem called leaky gut, that's an immune test we run. And if you're having leaky gut, what happens is large proteins are getting into your bloodstream through your gut system. Viruses, bacteria, they can all permeate across that gut and get into your bloodstream. And what they do is they trigger your immune system to constantly be on the alert, and it can really be an initiating trigger for autoimmunity. There's 3 parts to that test, and it looks at the cells of the gut, the stitching that holds the gut together, and it also looks for a lipopolysaccharide biofilm slime layer. If you have a high slime layer, we need to do certain things with digestive enzymes, probiotics, prebiotics, We need to use parasite herbs to use it to kill those parasites and break down that biofilm. So it depends on what is wrong with the leaky gut test. There's 3 different things to look for, and we have multiple ways to approach leaky gut depending on it, what we find versus just guessing. I really like to test, and I use some of the best tests out there. Cyrex Lab also has a gluten sensitivity test. Now, a lot of people nowadays are knowing there's more to gluten sensitivity than they used to be 5 years ago. People used to come in and they say, oh, I've been tested for gluten. And I look at their test their doctor ordered, and it's a very, very primitive way to look for gluten sensitivity. It's measuring in your bloodstream a reaction to the gluten protein. And if your gut system is wiped out, it's going to be a very weak response, and you're going to get a false negative. Cyrex Labs, I encourage you to go cyrexlabs.com and look at their labs, has a test for the 9 subcategories of the protein of gluten. And you could be sensitive to different parts of that. And based on what part of it you are sensitive to, you can have a different immune threshold and a different immune response. For instance, some of them cause an autoimmune attack against the gut. You'll have positive tissue transglutaminase enzymes, antibodies. The other thing, though, is say it's one of the other ones, and that could mean that you get exercise-induced asthma. They have it really broken down into look at gluten sensitivities as well as antibodies for your immune system. I mentioned parietal cells. Parietal cells are in your gut, and they help you absorb B vitamins. You can have an autoimmune attack in your gut to the parietal cells related to gluten sensitivity. And if you have that, you'll have pernicious anemia, meaning you're fatigued. So we have to really work to turn that around by changes in diet, healing the leaky gut, improving the gut health. Cyrex Lab also has an advanced test called Predictive antibodies. They can run a test and look at your immune system to see if you have the propensity or developing an autoimmune attack against the brain, the cerebellum, the myelin sheath, diabetes, and tissue transglutaminase, vitamin D receptor polymorphisms in your gut. So there's a ton of things that can be really going wrong with somebody that has a chronic health condition, and if you're not going to a provider who investigates it on this level, quite frankly, you'll never get better. Organic acid test. I really like the organic acid test. This is a urine test. It's an overnight urine test. And it looks at all the micronutrients, enzymes, cofactors, and minerals needed for you to make, through 2 passes of the Krebs cycle, ATP. Now what does that mean? It looks to see if you have enough fuel in your system to make energy. That's where ATP comes from. And so what we can do is when we run that test, we have the ability to look at do you have the basic ability to produce enough energy for every cell in your body? If you are limited, I will get a report back. It will tell me precisely what you need to make ATP. If you have needs, it will give me a custom blend of micronutrients for you to take for 90 days while we're rebuilding the other systems to start helping you make energy. The #1 complaint I have from people, secondary to their primary label when they have a chronic health condition, is general fatigue. They're tired. If you're not absorbing things in your gut, if you're not breaking things down in your stomach, if you're not assimilating your foods into fuel, you're not making enough neurotransmitters. And neurotransmitter production takes place in the gut. And neurotransmitters are the baseline chemical along with glucose to run your brain. So people have changes in sensation. Of course they do. Look at our society. The #1 thing people have a complaint secondary to gut problems is depression. you're not making enough fuel for your brain and chemicals to run it. And so they're put on antidepressants, and they're not being given anything to help them make more. They're trying to replace it or keep it around just a little bit longer. And what happens is it doesn't work for very long. Everybody habituates in 6 weeks once they're put on neurotransmitter support. So what we do is we work really hard to support you from a neurotransmitter standpoint. So that's how we work with people to help them improve their functional health. Once we start getting them functionally healthy in their gut and in their immune system, in their adrenals, making neurotransmitters, regulating their sugars, we work very hard to drive your brain with some activities in our office to make you start thinking better, to start helping you feel better, to help you recapture your life again. Now, we have some rules in our office when we accept new patients. The first one is, when I accept a new patient, is when I look at somebody's cases, do I sincerely feel I can help you? That's the first thing. The second thing I look at is, do I think that this person has enough support system in their life or enough drive to make the changes to get healthier? Because it does take a commitment. One of the rules we have in our office is, in order to become a patient for chronic health conditions in our office, you have to fill out all your paperwork first. It's all there online. You have to get it into our office, and you have to have your spouse or significant other come to your first 2 visits. That's our discovery visit. That's why we figure out what's wrong. The second part of the discovery visit, I go over, can I accept your case? What do we think the best approach is? How long do we think it's going to take? Are there stages in care that we need to start with? Is there any insurance coverage? Very little usually. And can I apply it toward your case? What is your out-of-pocket expense, and how can we make it affordable? We require you to fill that out and bring your spouse to the first 2 reports. So fill out your paperwork, get it to us, get with our front desk, schedule for our first 2 meetings. So when we do an evaluation in our office for looking at your chronic health condition, this is what we do. The first thing is, we look at you when you come in, and we're going to look at you for changes in movement, such as balance, coordination. We're going to do some specific neurological testing that are based on movement parameters. We're going to check you for sensory changes. We're going to look at small auditory input, touch. We're going to test your frontal lobe, your parietal lobe, your temporal lobe. We're going to look at you from a neurologic brain-based approach, utilizing those tests and also looking at the questionnaires you've filled out for us. So if it's something that you have an interest, what you have to do is you have to fill out your paperwork. Get it to our office. Our office will then contact you so that you and your spouse can come to the first 2 visits. That's our office policy. We're going to go over in our second visit, what did we find? What's the best approach? What kind of further testing do you need? What kind of nutritional supplementation or program do we recommend? What kind of time frame? What will your out-of-pocket be, and how can you make it affordable? If you're ready to do the things that it takes to change your life, then what I do is encourage you to watch our testimonials, watch this video again, fill out our paperwork, and I look forward to helping change your life. Thank you.